to present my study synchronously. I hope you enjoy this recorded presentation. Low-income workers faced a lot of risks during the pandemic. They were employed in jobs that are at high risk for loss of income. As you see this graph, recent unemployment filing data encompassing January of 2020 until late March this year indicates that millions have filed for unemployment benefits, reflecting widespread layoffs. Most claims were for people previously employed in service industries, particularly accommodation and food services, with an increasing rate for people in retail, wholesale trade, and construction industries. Workers in these industries are likely to be low wage, and they are likely to experience a loss of income. A third of low-income workers were employed part-time and may therefore be working fewer hours if hours were cut. 80% of low-wage workers were paid hourly, meaning if their hours are scaled back, they lose pay directly. Low-income workers who are still employed may face health risks due to the nature of their jobs. Common occupations for low-income workers include cashiers and retail salespersons, many of whom may not be working as businesses have closed. However, those who are working in essential businesses that remain open, such as grocery stores, have been in close contact with the public. Other occupations of low-wage workers, such as cooks and waiters, waitresses, may similarly still be working as restaurants move to delivery and take-out options, putting these workers in contact with the public as well. While a lot of workers remained at home under stay-at-home orders, these low-income workers have been engaged in positions that involved delivery of goods and services. Nearly 1 in 10 low-income workers reported that they are in poor health and were afraid that they are being put at increased risk for serious illnesses if they contract COVID-19. 3.5 million low-income workers are in the health and social services industry, with 1.3 million working as aides or personal care workers, such as nursing assistants, whose jobs bring them into frequent and close contact with patients. Nearly 1 million more work as direct contact support workers, such as maids, janitors, housekeeping and laundry, or food service workers, whose jobs also bring them into direct contact with others. Within these occupations, most are low-income people, and many of these workers are essential workers who are facing substantial health risks due to the nature of their jobs. Most low-income workers have Medicaid, employer-sponsored insurance, or other directly purchased private insurance. Medicaid plays a key role in providing health coverage to these workers because they tend to remain eligible for Medicaid even if they lose their jobs or their income drops due to lost hours. The problem is for the workers who had employer-based insurance. 45% relied on that insurance, but their coverage was at risk if they lost their jobs or income. Here, we cannot ignore these 21% of low-income workers who did not have any health insurance. They fell into the coverage gap and faced high out-of-pocket costs or access barriers to healthcare if they became ill. Many low-wage workers were already living in precarious financial situations before the pandemic and were not able to pay healthcare costs if they became ill. Over 28% of low-wage workers live in a household without a full-time worker in the family, and more than half were living in households whose incomes were below the poverty line. They were already facing food and housing insecurity and worrying about paying bills, which means they were not able to afford healthcare costs if they became ill. Their living situations also put them at additional risk. They are more likely to live in large family and more likely to have an older adult or a family member in the house who has a personal care need. This resulted in workers having poor health, particularly mental health. Even before the pandemic, many low-income workers reported health problems as they could not have timely treatment, had accessibility issues, and problems with medical bills. Because they have fear of taking on additional medical debt, they have not been seeking care for symptoms or illnesses. Based on these backgrounds, I had these two research questions. This study explored how the COVID-19 pandemic has impacted physical and mental health among low-income workers, with special attention to essential workers. Data came from the Household Pulse Survey administered by the U.S. Census Bureau, which has collected information on how the pandemic impacted households. This survey was designed to quickly and efficiently collect data on how people's lives have been impacted by the pandemic. Data collection for these phases started on April 23rd, 2020, and are still ongoing with a 2 weeks on, 2 weeks off collection and dissemination approach. I could use only these 3 phases because the question on whether they were essential workers was added on week 28. Using 15 weeks of data, the study sample was restricted to non-elderly, low-income adults who were employed when they responded to the survey. This study examined their changes in 4 measures of mental health status: frequencies of feeling anxious, worried, having little interest, and feeling depressed. For physical health, I identified those who responded they have any of functional limitations in seeing, hearing, and mobility. I identified them as those with physical health problems. I used an interrupted time series regression analysis to see the changes in health status before and after the intervention period. Since the Household Pulse survey began after the pandemic, I looked at the trend of the pandemic to see if there are other possible intervention points. Like all the other countries, the US experienced multiple waves. A large spike in COVID cases occurred over the winter month of 2020 when people traveled and gathered for the winter holidays. The FDA authorized vaccines arrived in December, but the effects started to show in the spring of 2021. Another surge began in July 2021 as the contagious Delta variant began to circulate and eventually dominate. The end of 2021 was not supposed to look like this, but Omicron variant drove new US confirmed and death cases to another dark winter. At the time I analyzed the data, my data covered only until February of 2020. So I decided to see this period as an intervention point for the time series analysis. This graph shows descriptive changes in physical health problems by essential work status. As you see, the essential workers had a bit different dynamic in health problems. In this wave. This graph shows descriptive changes in mental health problems by essential work status. As you see, higher proportions of essential workers have been having mental health problems during this whole pandemic, and the change appeared to be even worse during this wave. After controlling for demographic and socioeconomic factors, after the observed time, which was the third wave of the pandemic, low-income workers were at a greater risk for physical health problems than before the observed time. Essential workers were at a greater risk for physical health problems than those in non-essential work. After the observed time, essential workers were less likely to have physical health problems. For mental health, after the observed time, low-income workers did not experience significant change in mental health problems. However, essential workers were at a greater risk for mental health problems than those in non-essential work. After the observed time, essential workers were at a greater risk for mental health problems than those in non-essential work. Our analysis result show that the physical and mental health continued to deteriorate for low-income workers, which contracted the findings of other studies that showed general improvements of health status over time. Economic recessions placed a disproportionate burden on low-income essential workers with significant impacts on physical and mental health. During the pandemic and after multiple waves, essential workers were at increased risk of mental health conditions such as anxiety and depression, compared with those in non-essential work. These findings suggest the need to recognize the challenge this vital workforce face in pandemics and have an important public health and policy implication to protect this population. This impact on these low-income workers were notable, urging the implementation of specific measures and supportive solutions in this workforce. The challenges need to be focused on mental health and healthcare accessibility. Failure to tackle these health problems and healthcare accessibility will cause the population's coping capacity due to the constantly increasing proportion of vulnerable subgroups. We also may need to take compensatory mechanisms to protect this population who have been the most likely to suffer from the multiple waves and COVID-19 related restrictions. Thank you so much for listening to this presentation. If you have any questions, please reach out to me via email. Thank you.